Every single day, millions of people around the world take medications, believing they are helping their bodies heal. But what if I told you that some of these common medications could silently be destroying your kidneys? The kidneys are one of the body's most important organs, filtering nearly 50 gallons of blood every day to remove waste, toxins, and excess fluids. They help regulate blood pressure, balance minerals, control hormones, and keep your entire system in perfect balance. Yet these tiny bean-shaped organs are extremely sensitive, and certain medications, often considered safe, can quietly damage them. The frightening part is that kidney damage often shows no symptoms in the beginning. By the time symptoms appear, significant damage may have already occurred. Today, we are going to expose 10 common medications that could be harming your kidneys without you even realizing it. The first group of medications is known as NSAIDs, non-steroidal anti-inflammatory drugs. You probably recognize them as ibuprofen, naproxen, or aspirin. These drugs are widely used for pain, fever, and inflammation. But when taken frequently or in high doses, they reduce blood flow to the kidneys. Your kidneys rely on constant blood flow to function. NSAIDs constrict the blood vessels feeding the kidneys, starving them of oxygen and nutrients. Over time, this can lead to acute kidney injury or worsen chronic kidney disease. Studies published in the Clinical Journal of the American Society of Nephrology show a significant increase in kidney complications with prolonged NSAID use, especially in older adults or those with pre-existing kidney problems. It's easy to underestimate the risk because these medications are available over the counter, but chronic use, especially without medical supervision, turns them into silent kidney killers. The second category includes proton pump inhibitors, PPIs, which are widely used to treat acid reflux and heartburn. Medications like omeprazole, esomeprazole, and lansoprazole suppress stomach acid. While effective for short-term relief, long-term use has been linked to interstitial nephritis, a type of kidney inflammation. Even more alarming, some studies have shown that prolonged PPI use can double the risk of chronic kidney disease. Many people remain on these medications for years without realizing the hidden danger. The problem often starts with minor reflux symptoms. Patients take PPIs daily, assuming they are completely safe because they are so commonly prescribed, but the kidneys silently suffer. The third group includes certain antibiotics that can be nephrotoxic. Aminoglycosides like gentamicin and tobramycin are particularly harmful. These antibiotics accumulate in the kidneys and generate oxidative stress, damaging the delicate filtering structures. Vancomycin and some cephalosporins are also known for their potential kidney toxicity. While these antibiotics can be life-saving, their use requires careful monitoring, especially in older adults or those with pre-existing kidney disease. The risk increases with dehydration or prolonged therapy. The fourth category involves diuretics, often called water pills. Drugs like furosemide and hydrochlorothiazide help remove excess salt and fluid from the body, often prescribed for high blood pressure, swelling, or heart failure. But excessive or unmonitored use can lead to dehydration and severe electrolyte imbalances. This puts tremendous strain on the kidneys, forcing them to work harder under stressful conditions. According to research in the Journal of Hypertension, long-term use of diuretics is associated with a gradual decline in kidney function, especially in elderly populations. The kidneys need a precise balance of sodium, potassium, and fluids to work properly. When this balance is disrupted, serious damage can occur. The fifth group is paradoxical because these medications are often prescribed to protect the kidneys. ACE inhibitors like lisinopril and ARBs, like losartan, are staples in managing high blood pressure and diabetic kidney disease. However, when misused, especially in combination with NSAIDs or during acute illness, they can trigger a sudden drop in kidney function. This dangerous combination is known as the triple whammy effect. Regular monitoring through blood tests is critical when taking these medications to ensure they are not unintentionally harming kidney function. The sixth medication on our list is metformin, widely prescribed for managing type 2 diabetes. While metformin itself is not directly toxic to the kidneys, its use becomes dangerous in patients with significantly reduced kidney function. Impaired kidneys cannot efficiently clear metformin from the bloodstream, leading to a rare but potentially fatal condition known as lactic acidosis. The FDA has issued clear warnings regarding metformin use in patients with moderate to severe kidney impairment. This makes regular kidney monitoring essential for diabetic patients on long-term metformin therapy. The seventh medication group includes lithium, a powerful mood stabilizer used primarily in bipolar disorder. While lithium can be life-changing for mental health, long-term use has been associated with chronic tubulointerstitial nephropathy, a progressive form of kidney scarring. Studies in the American Journal of Psychiatry reveal that up to 40% of long-term lithium users may develop some degree of kidney impairment. Because lithium is processed through the kidneys, even slight dosage errors or prolonged therapy can slowly poison these vital organs over the years. The eighth group involves chemotherapy drugs, particularly cisplatin and carboplatin. These medications are highly effective at treating cancer, but are also highly nephrotoxic. They can directly damage the microscopic structures within the kidneys responsible for filtering waste. Oncologists closely monitor kidney function during chemotherapy, but despite this, kidney damage can still occur, sometimes leading to long-term impairment. The ninth category may surprise many people: contrast dyes used during imaging procedures like CT scans or angiograms. These dyes, although not medications in the traditional sense, can cause contrast-induced nephropathy. This is especially dangerous for individuals with pre-existing kidney problems, diabetes, or dehydration. The damage from these dyes can be rapid and sometimes irreversible. Always inform your healthcare provider of any kidney history before undergoing procedures that involve contrast agents. The final category includes over-the-counter herbal supplements. While often marketed as natural and safe, many herbal remedies can be harmful to the kidneys. Herbs like aristolochia are directly toxic and have been linked to severe kidney failure. Others, like high doses of licorice root or unregulated weight loss supplements, can disrupt electrolytes and blood pressure, indirectly stressing the kidneys. Because herbal supplements are not as tightly regulated as pharmaceuticals, their purity and potency can vary widely, increasing the risk of kidney toxicity. Many people assume that natural equals safe, but that is a dangerous misconception when it comes to kidney health. The frightening reality is that many people are unknowingly stacking these risks. An elderly person might take NSAIDs for arthritis pain, a PPI for acid reflux, a diuretic for high blood pressure, and a daily herbal supplement for general wellness, all while thinking they are taking care of their health. This combination, without proper medical supervision, becomes a ticking time bomb for the kidneys. The kidneys suffer silently. Unlike other organs, they do not produce clear symptoms early on. By the time you experience swelling, fatigue, foamy urine, or high blood pressure, significant and sometimes irreversible damage may have already occurred. This is why kidney disease is often called a silent killer. It creeps up slowly, often unnoticed, until it's too late. The good news is that awareness can make all the difference. Most of these medications can still be used safely if prescribed carefully, monitored properly, and taken responsibly. The key is understanding the risks, working closely with your healthcare provider, and being vigilant about changes in your body. Now that you understand how dangerous these common medications can be for your kidneys, let's shift our focus to solutions. The good news is, you don't have to live in fear. You can take powerful steps to protect your kidneys even if you need to use some of these medications. The very first thing you must do is build a strong partnership with your doctor. Never self-prescribe, never adjust dosages on your own. Your doctor can monitor your kidney health regularly through simple blood tests. These tests include serum creatinine, GFR, glomerular filtration rate, and BUN, blood urea nitrogen. These numbers tell your doctor how well your kidneys are filtering your blood. Even small changes can signal early trouble. Catching problems early makes all the difference. The second thing is hydration. Water is your kidney's best friend. When you stay hydrated, your kidneys can easily flush out toxins and waste products. Aim for pale yellow urine. That usually means you're drinking enough, but be careful not to overdo it. In conditions like heart failure, too much fluid can be dangerous. Always ask your doctor how much water is right for you based on your health conditions. The third important step is to avoid polypharmacy. Polypharmacy means taking many medications at the same time. The more medications you take, the higher your risk of drug interactions that can damage your kidneys. Seniors are especially vulnerable. You may be taking blood pressure pills, diabetes medications, painkillers, acid reflux medicines, and maybe even supplements all at once. Some combinations can silently hurt your kidneys. That's why it's crucial to have your doctor or pharmacist review your entire medication list every 6 to 12 months. This simple review can uncover dangerous drug combinations before they harm you. The fourth solution is being extremely careful with over-the-counter drugs. Many people assume that non-prescription drugs are always safe, but that's a dangerous mistake. NSAIDs like ibuprofen and naproxen are very commonly abused. People take them for months or even years to manage arthritis, back pain, or headaches, but every pill adds strain on your kidneys. Even cold medications often contain multiple ingredients that may stress your kidneys or raise your blood pressure. Always read labels carefully, follow the exact recommended dose, and if you need to take these drugs regularly, talk to your doctor. The fifth key to protecting your kidneys is minimizing long-term medication use whenever possible. For example, PPIs like omeprazole should not be taken for years unless absolutely necessary. Lifestyle changes like weight loss, dietary adjustments, and elevating the head of your bed can often control acid reflux without needing medication. The same goes for NSAIDs. Instead of popping pills for joint pain, try physical therapy, exercise, or anti-inflammatory diets that can naturally reduce pain and inflammation. Even high blood pressure can often be controlled controlled through weight loss, reducing salt intake, regular exercise, and stress management, which may reduce your need for certain medications that can stress your kidneys. The sixth tip is to include kidney-friendly foods in your daily diet. Certain foods are gentle on your kidneys and reduce inflammation. Berries are full of antioxidants that help protect your kidney tissues. Red bell peppers are low in potassium and packed with vitamins A, C, and B6. Garlic not only adds flavor, but fights inflammation and reduces cholesterol. Olive oil provides healthy fats that reduce inflammation. Cabbage is low in potassium and phosphorus, making it kidney-friendly and rich in fiber. Adding these foods to your diet provides extra protection for your kidneys. The seventh important solution is taking special care during illnesses. When you're sick with vomiting, diarrhea, or fever, you lose fluids quickly. Dehydration puts huge pressure on your kidneys. During these times, your doctor may advise you to temporarily stop certain medications, especially NSAIDs or diuretics, to avoid further kidney strain. Always keep your doctor informed when you're sick. The eighth solution is watching for early warning signs of kidney damage. Kidney disease often progresses silently, but certain symptoms can give early clues. These include swelling in your legs or ankles, foamy or bubbly urine, which may indicate protein loss, unexplained fatigue, trouble concentrating, shortness of breath, loss of appetite, muscle cramps, or unusually high blood pressure. If you notice any of these signs, don't delay. See your doctor and ask for kidney function tests. The ninth solution is to be extremely cautious with herbal supplements. Many people wrongly believe that natural products cannot harm them, but some herbs are directly toxic to the kidneys. Aristolochia is one example that has been linked to severe kidney failure. Even herbs like licorice root, when taken in high doses, can disturb electrolyte balance and strain your kidneys. Some unregulated weight loss products contain harmful substances that indirectly hurt your kidneys by raising blood pressure or dehydrating your body. Always consult your doctor or pharmacist before starting any herbal supplement, no matter how safe it seems. The 10th and final solution is adopting overall kidney-friendly lifestyle habits. These habits help protect your kidneys even if you need certain medications. First, control your blood sugar tightly if you have diabetes. High blood sugar slowly damages the tiny blood vessels in your kidneys over time. Second, maintain healthy blood pressure levels. High blood pressure is one of the leading causes of kidney damage. Third, stop smoking. Smoking narrows blood vessels and reduces kidney blood flow. Fourth, limit alcohol. Excessive alcohol stresses your liver and kidneys. Fifth, exercise regularly to maintain a healthy weight and improve circulation. Even walking 30 minutes a day can help. These simple lifestyle changes provide powerful protection for your kidneys over time. Remember, your kidneys work quietly in the background, doing their job without any complaints. But once they start to fail, reversing the damage becomes very difficult. That's why prevention is so critical. You can take control starting today by working closely with your doctor, staying informed, monitoring your medications, eating wisely, and making healthy choices. You give your kidneys the best chance to serve you well for many years to come. Even if you need medications from this list, the risk to your kidneys can often be managed safely with proper precaution. Let's now bring everything together because this information may very well save your life or the life of someone you love. You've now learned that many medications you thought were harmless can secretly damage your kidneys. But you've also learned that you are not helpless. You have the power to take control. Your kidneys are small but mighty organs, and they work for you every single second of every single day. They filter your blood, they remove toxins, they balance your fluids and electrolytes, they regulate your blood pressure, but they are also incredibly sensitive, and sadly, they rarely give you loud warning signs when things go wrong. Many people only discover they have kidney disease after years of slow, silent damage. This is why taking action early is critical. Start by understanding that not every medication is dangerous on its own. Most are very helpful when used correctly. The problem begins when they are misused, taken for too long, or combined with other risky drugs. NSAIDs, for example, are excellent at controlling pain and inflammation in the short term, but when taken daily for months or years, they slowly choke the blood flow to your kidneys. PPIs are wonderful for soothing heartburn quickly, but long-term use without medical supervision can lead to kidney inflammation. Antibiotics can kill deadly infections, but certain types like aminoglycosides can accumulate in your kidneys and create harmful oxidative stress. Diuretics can help with blood pressure and swelling, but misuse leads to dehydration and electrolyte imbalance. Even medications designed to protect your kidneys, like ACE inhibitors or ARBs, can turn harmful if not carefully monitored, especially when combined with NSAIDs. Metformin helps millions manage their diabetes safely, but for those with kidney failure, it can cause lactic acidosis, a rare but life-threatening condition. Lithium provides crucial stability for those with bipolar disorder, but it can cause irreversible kidney scarring over time if blood levels aren't monitored closely. Chemotherapy drugs like cisplatin are necessary for fighting cancer but carry high risks of nephrotoxicity that require constant monitoring. Contrast dyes used in imaging tests can sharply damage already vulnerable kidneys in a short time, and even natural remedies like herbal supplements can quietly destroy your kidneys if not used carefully. This is not meant to scare you, but to empower you. Every one of these risks can be managed if you stay aware, stay informed, and stay proactive. You have the power to protect your kidneys starting today. First, always involve your doctor when starting, changing, or stopping any medication, even over-the-counter pills, even herbal supplements. Second, request regular kidney function tests, especially if you take any of these high-risk medications. Third, review your full medication list with your doctor or pharmacist at least once or twice a year. This simple review can identify dangerous combinations and unnecessary medications that may be harming you. Fourth, never underestimate the importance of staying hydrated. Your kidneys depend on proper fluid balance to flush out toxins effectively, but also remember that some conditions like heart failure may require fluid restrictions. Follow your doctor's advice carefully. Fifth, work hard to minimize long-term dependence on medications wherever possible. Sometimes lifestyle changes can reduce or even eliminate your need for certain drugs. Lose excess weight. Cut back on salt and sugar, manage your stress, quit smoking, exercise regularly. Even small daily changes can create enormous protection for your kidneys. Sixth, build a kidney-friendly diet full of antioxidant-rich foods that reduce inflammation. Eat berries, red bell peppers, cabbage, garlic, and healthy fats like olive oil. Avoid highly processed, salty, or sugary foods that place extra burden on your kidneys. Seventh, stay extra cautious during times of illness. If you are dehydrated from vomiting, diarrhea, fever, or surgery, ask your doctor if you need to temporarily pause certain medications like NSAIDs or diuretics. These small adjustments during vulnerable times can prevent permanent kidney injury. Eighth, learn to recognize the early warning signs of kidney damage. Watch for swelling in your legs, puffy eyes, foamy urine, unexplained fatigue, high blood pressure, shortness of breath, or loss of appetite. Early action gives you the best chance to stop further damage. Ninth, be very careful with herbal supplements. Just because something is sold in a health store doesn't mean it's safe for your kidneys. Always check with your doctor before starting any new supplement, especially if you take prescription medications. Finally, remember that prevention is always easier than treatment. Once your kidneys are severely damaged, treatments become more complicated. You may need dialysis or even a kidney transplant. That's why your best strategy is prevention. Start now while your kidneys are still working. Start today, not tomorrow. Every healthy choice you make adds protection to these precious organs. Think of your kidneys like a hardworking silent partner in your body. They ask for very little, but they give you everything: clean blood, balanced fluids, healthy blood pressure, strong bones, and overall vitality. You only get 2 kidneys. You don't want to wait until you lose their function to appreciate how much they do for you. Take control now. If you are taking any of the medications we discussed today, don't panic, but do take action. Set up an appointment with your doctor. Get your kidney function tested. Review your medications. Ask questions. Get informed. Knowledge is your best defense. Share this knowledge with your loved ones. Many people are silently damaging their kidneys right now without knowing it. Your simple conversation could protect someone you care about from irreversible harm. And if you found this video valuable, please hit the like button. Subscribe to this channel for more life-saving health information. Leave your questions and comments below. We are here to support you on your health journey. Don't wait for kidney damage to sneak up on you. Start protecting your kidneys today. Small changes now can save you from big problems later. You have the power. Use it. Stay safe, stay healthy, and always take care of your kidneys.